Welcome, welcome, welcome. Hello, fabulous listeners and viewers. I'm Ande Lyons, and I'm 68, and yeah, I'm feeling great. And you're tuning in to a special live episode of Don't Be Caged by Your Age. If you're new here, this podcast is all about shattering age-related expectations and stereotypes and proving that life after 60 is just the beginning. Let me get my clappers out for that. Woohoo! Now, normally I only interview guests 65 and older because, hey, representation matters, right? But today we're shaking things up. This episode is an intergenerational conversation because the pro-aging movement isn't just for those of us who are over 60. It's for everyone who believes in shifting the narrative around aging. And I'm so thrilled you're here because today we are diving into a conversation that truly matters: mental health and older adults. How often do we really see those words combined, right? But May is both Older Americans Month and Mental Health Awareness Month. So I had to invite today's guest to join me for a delicious and impactful conversation. She's brilliant, bold, and deeply compassionate, and she's dedicated her life to breaking the silence around aging and mental health. That's right, our guest is Dr. Regina Koepp, a Stanford-trained, board-certified clinical psychologist and one of the nation's leading voices in geropsychology. Yeah, that's a real word, and you'll learn what it means shortly, okay? She's the founder and CEO of the Center for Mental Health and Aging and a go-to resource for trusted information on aging, caregiving, and mental health. Her work's been featured in the New York Times, NPR, AARP, and more. And we're thrilled she's here with us today. Whether you're aging yourself, supporting loved ones, or simply curious about thriving after 65, this conversation is for you. Are you ready? Well, here's Dr. Regina Koepp. Woohoo! The crowd goes wild.
Yay!
How are you, Dr. Regina?
I'm great. Thank you so much for having me.
Oh, welcome to the Don't Be Caged by Your Age podcast. I'm so happy you're here, and I'm so happy you were willing to join me on a live stream event. Folks who are tuning in, be sure to add your comments, thoughts, questions to the comment threads, whether you're tuning in on YouTube or LinkedIn, just like Amy has right here saying, so looking forward to this talk. Well, always so happy to see you here, Amy. We have so much to go over. As I've said in a lot of the promo materials I put out there, Dr. Regina, I have so many questions. But before we get started, please share with everyone where you live and how long the world has been enjoying the gift of your presence.
Yes. So thank you, Ande, so much for having me and spotlighting mental health and aging. It's such an important and under-discussed topic. So thank you. It means the world to me. And I live in Burlington, just outside of Burlington, Vermont. And I've lived here for 3 years. So I've had 3 winters in my whole life because I grew up in Los Angeles. I grew up in Southern California. Yeah. And it's just the greatest place to raise kids.
It really is. And boy, did you have a snow season this year.
Good gravy, did we? Yes, it was a long, cold winter. And now I can say that because I'm 3 years in, I have enough to compare. And it's been a long, cold spring.
Oh my gosh, everyone. Seriously, we have had the heat on the whole time. I live right down the road in Massachusetts, so I love talking to a fellow New Englander. So thank you, Dr. Regina. I'm glad that you're right up the road, and we can go on forever about the weather here in New England, because if we didn't have the weather, what would we talk about?
Aging.
Aging. So I need to find out and have you share with everyone what inspired you to pursue a career focused on mental health and specifically older adults and mental health. Was there a personal experience or a pivotal moment that led you down this path?
Yes. Yeah. Well, and I also didn't answer the question how old I am.
Oh my gosh, I forgot. Yes, that's right.
Yeah. So I'll answer both. So in 2 days, I will be 49 and it's very exciting.
Happy birthday, Regina.
Yep. And let's see. Why mental health and aging? So I don't have a romantic story, but I have my story of mental health and aging and what inspired me to build a career in psychology focused on psychotherapy with older adults and older families. So I grew up in Southern California, and I was raised by a single mom. Didn't know my dad. I have 4 brothers. They didn't know their dads, and we were raised in a pretty fractured family. My mom had severe mental illness. She's still living, and as an older woman herself now, is actually the healthiest I have ever seen her in her whole life. And this is a phenomena that happens as people mature and age. Doesn't happen to everybody, but what happens as we mature and age is that we develop more resilience. And what a colleague of mine named Mark Brennan calls crisis competence, that we get competent in navigating crises. And because with age, we have more opportunities to experience hardship, that also gives us more opportunities to develop our resilience muscle. And so what we see in the field of mental health actually is that as people age, the rates of mental illness decrease and the rates of resilience increase. And so that is quite inspiring, because
Well,
we're fed this message that it's all
right?
about decline and loss, but in fact, we gain so much
That's much.
psychologically and spiritually.
And this is so important right now, especially in America, when we're going through very difficult times, and we still have this perception, real ageist beliefs around in corporations, that anybody over 50 is permafrost. And a lot of folks have been talking about how important it is now more than ever to bring in older adults on a team. And it's right there, crisis competence.
Oh, and
Because
there's an inflappability that happens. You've kind of experienced it all. You've seen both sides of the coin. You can
right,
hold the line when people are anxious or scared. Also, as we age, we become better problem solvers. This is science. This is not just me. This is what the
right.
research is showing. We have better emotion regulation. People still get sick, and people still have mental health concerns. And at the same time, we're developing these other skill sets as well.
Right. So you grew up in a home
Yes.
where you saw how important mental health is when it's not working.
Oh, yes. So I saw the trauma of mental
Mhm.
illness
Yeah.
and fractured family life. So my mom, this was the 70s and 80s. My mom would go into the hospital for long periods of time, months at a time, would live with other families. And I think part of what drew me, and then my mom would get us back, and but part of what drew me to working with older adults is that my life has been sort of creating a quilt of families to raise me, and I didn't have access to many older people. And I think unconsciously, spiritually, psychologically, I needed to be around older people to show me the arc of the full human experience, which I didn't have access to. And so the other piece of it is, as I was training, I in my doctorate program, I trained on a hospice, inpatient hospice unit as a psychotherapist bedside with people who were dying. And I was so moved by just the intimacy at the end of life, but also how vulnerable, we're at the heightened, most vulnerable stage and state you could be, dying,
Yeah.
and how incredibly growthful and resilient people are in that process.
Right.
And that I remember I had this conversation. I was just thinking about this morning. A patient or a person who was dying said to me, asked me in psychotherapy, I was probably in my early 30s, "Are you afraid to die?" And he was dying. And I said, "Yes." I had this honest response in conversation with him. I was
Sure.
like, "Yes, my life is not complete. I haven't done everything I want to do. Like, of course I'm afraid to die." And then of course, that wasn't about me, but I wanted to reveal that I could have an honest conversation. And I asked him, "And you, are you afraid to die?" And he said, "No, I'm ready." And he was on hospice, he was preparing,
Right.
and I thought, this is the most powerful thing, that how could we, like, we're living in a society that prioritizes vitality and youth, and actually, what an incredible position, and how spiritually evolved must a person be to be ready to let it
Right.
go, to let the physical body go. And so I thought, well, First, I also was living in this juxtaposition in my early life of vulnerability and resilience. My mom was a single mom, kids living in poverty, not a lot of resources. And she was so incredibly resilient. And it was hard for me to find these places where a person could demonstrate both vulnerability and resilience. And working with older adults, I found that in spades. So I got so much reward from one, it helped me understand my life experience a little bit more,
Right.
helped me feel less alone. And then also what a gift to be with people and whatever their journey is in older adulthood. I'm describing end of life, but that's not the whole older adult
Of course
experience.
not.
But that's one part of the
Right.
experience. And then I thought, well, I can't go anywhere else because this is pretty thrilling.
And it spoke to you. You were compelled. I can see it in your face, your body language, everything. It really jazzed you up. And so you became specialized in this wonderful word, geropsychology. And so for those who are unfamiliar with this term, would you please explain what a clinical geropsychologist does and why this specialty is so important today?
Yes, happily. So, your listeners probably know a psychologist is somebody who specializes in biopsychosocial aspects of mental health. And so, a psychologist can do psychotherapy, can do assessments to help identify mental health conditions. A geropsychologist is a psychologist who specializes with older adults and more of the clinical aspects of aging in terms of depression in older adults, anxiety, substance use disorders, dementia disorders, family caregiving dynamics. And so my role as a geropsychologist has been to provide psychotherapy to families, to train other clinicians in providing psychotherapy to older adults and families, navigating complexities that can come with aging, and so on.
Right.
So it's largely, in my role, psychotherapy. Other psychologists, however, might do research, might do neuropsych assessments to identify dementia disorders or other conditions more common in older adulthood.
And that leads me to the question of, you could have been practicing this and just fine, but you launched a business. So before I dive into the many questions I have, please share with folks why you founded the Center for Mental Health and Aging.
Yeah, so for more than 20 years, I have been working with older adults in clinical systems like at Stanford, Emory, Veterans Health Administration, University of Vermont Medical Center. And I saw in every system I worked in that everyone from a health tech to the medical director had no idea what was typical with mental health and aging, when it's depression, when it's dementia, how to differentiate the two, that what do you do? How do you navigate mental health and family concerns? How do you help people have difficult conversations about long-term care or end-of-life planning or navigating a new medical condition?
Right.
And everybody had questions, especially in the ambiguous stages of cognitive disorder, or especially when there's been complexity in the relationship earlier in life, and then you're thrown back into the relationship in a later stage of life. And how do you navigate those pre-existing dynamics now that the ante is raised, and there's a pressure cooker of decisions that need to be made, and life is on the line. And so everybody had questions and nobody had answers, and very few people are trained in this. And so what would happen in medical system is that clinicians and health techs and everybody would start reaching out to me and asking me questions. And so it demonstrated a need.
Right.
And I created programs to train health providers and mental health providers in the systems I worked in to meet the mental health needs of older adults. And I thought, well, I'm ready to take the show on the road and make sure, and have my own company, the Center for Mental Health and Aging, where that's what we do. We provide training
Excellent.
for mental health providers, and then we improve access with a provider directory.
And accredited training, right? So they get their, was it CCEs? I don't know what they're called, but they're special.
CEUs. Yep.
Yeah, they're so important. And I found this quote on one of your feeds, LinkedIn perhaps, but I thought it was so important as we're talking about something like mental health in older adults. And this is the quote: "The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet." And that quote comes from Rachel Remen. But I thought that was so important, and that we need to really remember that our mental health is just like our physical health, or even like keeping your car working and functioning, right? If you don't take care of the wounds, the challenges, the trauma, it will just keep deteriorating. And it's just so important that we have the mental health. And I know personally from having, I'm 68 now, but when I turned 65 and had my first quote Medicare physical, I was like, what the heck is this? It was terrible. And I felt like somebody pet me on the head and nobody cared anymore. Did you have a mammogram? How's your bone density? All the things that were really important. How are you feeling? Nothing.
They didn't ask those questions.
No. In fact, if I can just take a moment to
Please.
be a little selfish here, I sat down with my good friend ChatGPT and asked for some help in writing a letter to my doctor because it became unacceptable, this level of uninterest in my health. And because I knew I would come across a little too emotional. So, but I just said, hey, and listeners who are not watching the video, this is what I wrote. I'm reaching out with some concerns about the level of preventive care I've been receiving since turning 65. I've noticed a significant drop in the thoroughness and attention during my annual physicals. They feel quite cursory, and I'm not receiving the kind of proactive medical guidance I believe is important for someone in my age group, especially as a woman. I would appreciate a discussion about how we can ensure I'm receiving comprehensive care moving forward, including all recommended age-appropriate screenings and preventive measurements. I want to feel confident that my healthcare team is supporting me fully as I age. And I'm happy to send anybody that script because you have to, right? You have to take control over that, right, Dr. Regina?
Well, and if you don't, the consequences are profound and plentiful, unfortunately.
Right.
And our system is undertrained to address physical, mental health, spiritual needs of older or people 65 and older. And the other piece of this is we start tracking older at 65 to 122,
right?
Which is almost 60 years. Like, how could we put everybody in this one
exactly
almost 60-year bucket? And so I think, so that's what you're demonstrating there is structural ageism,
right?
And how it's playing out for you. We see this with mental health as well, and in that older people, depression goes undiagnosed and untreated. Anxiety, substance use disorders don't even get screened because you don't look at an older person and think that they're struggling with substance use.
Oh my gosh, I didn't even think about that, but of course. Oh my gosh. And so, and this is the thing is the stigma is so there for mental health period, but now to bring the focus and the spotlight, I love that you're doing that. And before we dive into some of the most common mental challenges, I want to bring up Amy's comment. Amy, thank you for sharing this. Such an important practice for aging folks. I remember my grandmother struggled as her friends were passing away and she didn't have close friends around. And that's, of course, what I'm going to be talking about a little bit later, Amy, as well. And then she goes on to say, amen, Ande, that might also be helpful for women in perimenopause with lack of empathy and help. Yes. Yeah. We have to speak up and we have to demand the support. But I showed a screenshot a little earlier here about depression in older results. Now, I know you spoke earlier about how we have built up crisis competence and resilience and all the things as we age, but depression can really set in, especially as we begin to look at our end of life, right? And certain things can crop up. And a lot of times, one of the things that you talk about too is not just the impact of grief in later life from losing a spouse, dear friends, as Amy was talking about, or more importantly to me, your independence. I mean, we want to be interdependent in life, of course, but there's certain things we want to be able to do by ourselves that make us feel good. What are healthy ways to start moving through this? And how do we talk about this with our children? And how do our children talk to their parents who are clearly, might be stuck on the couch and not getting up anymore because why bother? They're no longer employed. They're thought of as invisible. What are your thoughts, Dr. Regina?
You touched on so many points here. So one thought, and you also showed the cards of what happens when mental health concerns go undiagnosed and untreated.
Right.
I think you're also sharing your personal experience of being treated as irrelevant, invisible, not getting the care that you need. And so what happens when depressed older people don't get mental health care, or anxious older people, or people using substances problematically don't get mental health care, is that medical problems get worse, that people start to use more medication for those medical problems. And older adults often complain that they're taking too many medications to begin with. Then they have more ER visits and longer hospital stays, which when you add all of that up, costs more money, because even with Medicare, you're still on the line for covering part of the cost depending on your plan. And then it increases family strain and caregiver stress, increases the risk for death and higher risk for suicide, and increases risk for other medical conditions like dementia disorders. So depression is on the Lancet Commission list of 14 modifiable risk factors for what we can change to change our risk for dementia. And depression is on that list. But everything else, all the physical health, gets more airtime than the mental health. And
where the root cause could be the mental health causing all the other things, which listeners who tune in a lot already know this, Dr. Regina, which is that there's a study, the World Health Organization study from 2021, that says retirement is costing societies billions of dollars for this very reason, right?
And ageism costs in 1 year billions of dollars, and is responsible for the most expensive medical problems in 1 year. And we could change it by doing like what you're doing, Ande, with sending the letter to your doctor and saying, I'm being mistreated due to ageism, and this is how I'd like it to be changed. And it was a very civil letter, and now you're willing to share that letter. And so if we could all start giving this feedback to the doctors and therapists, everybody that's representing the system, and ourselves too, because if we get this message and we don't challenge it and we internalize it, then that affects our physical health. That affects our mental health. People who hold negative age stereotypes have a higher risk of anxiety and post-traumatic stress disorder and suicidal ideation, and lower chance of being treated for those things because of ageism, in the structural sense of ageism, that you're not going to get identified and treated.
That's right, because, you're done. Go out to pasture. That whole bias is amazing and just so frustrating, which is why I turned to ChatGPT, so I would keep it calm, cool, and clinical versus what I really wanted to be saying. Folks, we're talking to the amazing, the bold, the brilliant, the fabulous clinical geropsychologist, Dr. Regina Koepp, founder and CEO for the Center for Mental Health and Aging. Please visit mentalhealthandaging.com to learn more about how you can work with Dr. Regina or take advantage of the resources she has, or just to up your own game and understanding how all of this mental health in an older adult works. This is May, but it's Older Americans Month and Mental Health Awareness Month, but we need to have it be monthly, daily, 24/7, 365, right, Dr. Regina? Talking about all these issues. Amy says, calm, cool, and clinical. Clever. I know. She knows me too well. So we are living longer, but that also means managing chronic illness, pain, or disabilities. And that's where I think mental health is so important. Many of us over 65, maybe we're still moving and grooving, but our bodies have changed. We do not look anything like we used to. We're having our eyesight, our hearing, say what, all sorts of things happening. And then the disabilities can click in, or a chronic illness, or you're fighting a life-threatening illness, or you're living with someone who's fighting a life-threatening illness, or just getting ready to go into hospice. There's so many challenges. How can older adults even have this conversation? Forget asking for a mammogram and a bone density. Can you talk to our professionals to help us navigate not just the physical challenges, but our mental attitude and the stories we tell ourselves about our disabilities or challenges with our bodies?
Yeah, and I'm so glad you're bringing this up, because I will say physical health, mental health, spiritual health, social health, they're all inextricably linked. And so, especially physical health and mental and spiritual health, because when we are experiencing something physically, so we're diagnosed with a new life-altering or chronic health condition, that increases our risk for depression. When we experience a new limitation, a functional limitation or a disability, that increases our risk for depression and anxiety. When we lose independence, as you're talking about, it increases the risk for mental health concerns like depression and anxiety. And so all of chronic pain increases the risk for depression. And so, and 60% of Americans who are living with chronic pain are over 65. And so the majority of people living with chronic pain are older. And so we have to be safeguarding our mental health, because 85% of people 65 and older have a chronic health condition, which means, so your risk is higher and you're resilient. And so to remember that you are not the sum of your illness, you are your full self, right? And so you have resiliency and you are experiencing hardship, and finding a way to honor both experiences, I think, is key. It's not healthy to be Pollyanna and avoid the health condition or the limitation. And that inspires, as you mentioned earlier, Ande, a lot of grief. The loss of independence results in grief. Your life is not the same as you knew it. And it's important to lick your wounds, because that's part of healing.
And one of my concerns has always been, because I had a very, not chronic, complex PTSD throughout my childhood.
Yes.
So all of a sudden I'm thinking, oh, there goes my short-term memory. What am I going to do? Hang out in all the bad years from 0 to 30?
Right.
All that trauma, which is, if anybody has worked on their trauma before, that yes, there are wonderful modalities out there that can help you rewire your brain and actually wire trauma out through neuroplasticity and doing all these wonderful techniques. But it still requires you to ask the questions and ask for the guidance.
Yes.
What advice do you have for someone over 65 who feels like it's too late to start therapy to heal past wounds? Maybe, a rape they never dealt with, or some horrible thing that happened that they just put on a shelf, all of a sudden is cropping up in their head. Instead of just being tough and trying to tough it out, quality of life is important at this age too. It's not just for anybody younger. Quality of life right to your last breath, Dr. Regina. I feel so strongly about that. And that's why I'm so passionate about what you're doing. What do you say to folks who are saying, well, why bother?
Yeah, well, I would say that's a lie you've been told. And so hold that for a minute. I also have a saying that there is no expiration date on healing, transformation, and love. And the reason I say this is because I have worked with thousands of older people, probably older than the average age of your listener. My average patient is 85. And so thousands of people who are not finished transforming and healing and growing. And I have seen how powerful it is. From somebody who had a gambling addiction and came to my office and was secretive about it. He came to my office because he had a fall and broke a hip or something. I can't remember what exactly he broke, but he had a functional limitation. And then because he broke something and got a scan, it was revealed that he had cancer. And his cancer was very, very late stage. He was in his 80s. And over a couple of sessions, then he revealed to me that he had this gambling addiction, had lost his entire savings, and he would need to move out of his home. And imagine this person is given a life-altering medical condition. His spouse had died a couple of years earlier, and now he is financially destitute, and now he needs to find another place to live, and he's considering asking his son. And this is weighing heavily on him because he had prided himself on being a provider, and now he's not going to have this financial legacy to leave to his children, which is first he experienced a lot of shame about, and was devastating to him that he wouldn't have this legacy. And in his work in psychotherapy, he had a belief in himself that he was willing to work on this and to heal this aspect of his life. This wasn't easy for him. He carried a lot of shame about it. He was also coming to terms with his life and end of life, and asking then his son if he could live with him in this stage of his life. His son said yes. And over time, this fostered the closest relationship that they had together. And his son had a need where the father living with him was actually going to be quite helpful, even though the father also had needs. And so I would say there's a lie that we're told that you were giving earlier, Andy, that we're out to pasture, we just need to go in a cave and die, or that mental health conditions are highly stigmatized. And so if you go to therapy, then you're weak or defective or something like that. And this is a message that so many people were given, especially people in their 70s, 80s, 90s. Imagine, I've worked with a lot of World War II veterans and Korean War veterans, and coming from war, there were not terms like PTSD or post-traumatic stress disorder, that you were shell-shocked or that you were never the same again. But we didn't have language to talk about this. And now we have language. And I like to tell people, we did your generation a disservice we contributed to, society contributed to the stigma. And now we know better, and we're doing better, and you deserve better. And what if I told you that depression was a medical condition that's treatable? Anxiety is a medical condition that's treatable, and it's treatable for older adults the same level as other age groups. And when it comes to substance use disorders, they actually have better outcomes than younger age groups.
Oh my gosh, I can't wait to tell Kevin Heyer this. He has this wonderful foundation called the Heyer Foundation, which is deals with substance abuse and white collar employees. But I recently met this wonderful man and shared space with him. Michael Booth, thank you so much for chiming in. He's saying, I love what you're saying, Dr. Regina. I will add, though, that it is harder to get diagnosed with what you are saying if you are younger. These symptoms are expected in over 65s, wrongly. Then with dementia, we are lumped together with older people despite being in my early 50s. So depression is a big factor. And Michael openly talks about how he got diagnosed. I think, Michael, wasn't in your late 40s, you got diagnosed with dementia, right? And so this again is, we have these stories that we tell ourselves, and that the media, everybody keeps pounding it into us about dementia. Like the minute you get diagnosed, it's all over. And that's not the truth. There's so many different stages. Right, Dr. Regina?
Oh, that's right. Or this idea that you're incapable if you have dementia, when you can be living independently for many, many years with dementia. And I'll also say there's a thought for older people that depression is normal after 65, or that dementia is normal after 65, or anxiety is normal. And that's not true. Those are ageist thoughts as well. And if we don't know that it's not normal, then what's going to happen is then people aren't going to get referred for care. So if we believe that it's typical, why would we send people for treatment? If it's expected.
Exactly.
And then that leads to needless suffering, of course. And then what's interesting about dementia and depression is that depression, as I mentioned earlier, can be a risk factor for dementia and also an early symptom of dementia. And so this is why we need people or professionals trained to understand differentiating depression, dementia, or is it both? Is it depression on its own that we could be treating? Also, depression is treatable with people living with dementia as well, all throughout the stages, not just in early stages. And so how do we shift our ageist thinking and ableist thinking, so that we're helping people with life-altering conditions like a dementia disorder live fully and live free of suffering and live to be engaged in the world around them.
Right. And you hit the nail on the head there, Dr. Regina. It's the training. So, for example, Michael, when you start getting your symptoms of early dementia at maybe it's not early onset that feels so life threatening and debilitating, but in a form of dementia, people who are trained are going to go, oh, okay, here we go. This is great, because they'll be able to screen it earlier. But as you get older, if they've had a switch in their head that says, oh, you're 65 plus, next, that won't work. And if I may be so bold as to share one of my own personal experiences due to complex PTSD, I had developed insomnia, which after a while, it's no longer about the trauma. It's just how the neurons in your brain work. 40 years I tried to solve insomnia, could not. What I have done with no sleep or a few hours of sleep, even taking graduate level tests and finals, unbelievable. But when I turned, I think it was 66 or 65, right around that time period, I said, I'm either going to solve this or learn to really embrace it. It's no longer going to be this big fight. And I found a guy out of Dana-Farber here in Boston, Cancer Institute, who helps adults and children with sleep disorders, but he also has a private practice. The first conversation I had with him, I said, oh my gosh, this is the first time anyone has identified insomnia in a way that I've experienced it, which is just a programming thing. And you get panicky and everything. Mm-hmm. And he figured out that I was always trying to get that coveted 8 hours of sleep, where my brain and body only need 6 at the most. And so it was just a self-defeating thing. Yeah. Within, I think we had 4 sessions over an 8-week period, done. And then it took about a good year to sort of get completely settled in. 3 years later, I never think about it. So I'm about to turn 69 in August, everyone. Imagine 40 years. And what if I had copped the attitude of, well, I'm too old, may as well just deal with it. Older people don't sleep well anyway. Instead of going, oh my gosh, this is fixable. What they know about the brain nowadays, it's not always talking out loud cognitive behavior therapy. A lot of times it's EMDR. It's all these different things they can do with your brain to help you. And you deserve it after the age of 65. You deserve quality of life and meaningful life until your last breath. What are your thoughts, Dr. Regina?
Well, I have so many thoughts. One, I truly admire, Ande, your willingness to share your experience as well, because I do think that's also how we bridge people from staying out of care to care, is if we talk about what care actually looks like, and that you and I go to mental health care and psychotherapy and insomnia treatment, and so can you. And it I think destigmatizes it, but it demystifies it. Right. And it normalizes it. And it shows, like, actually, this is how it was helpful to me. And if you had diabetes and I kept insulin away from you, that would be cruel. If you have a mental health concern and I keep psychotherapy away from you, and whatever technique is recommended for the condition that you have, that would be cruel. Right. and unnecessary. And so that is one, is I just so admire your willingness to talk about your experience and to talk about bridging your experience to another person's experience so they too might give it a shot. I will also say what I loved about your experience with insomnia treatment is it was tailored for you and not you to it. And so
thank you. Yes, exactly.
And that it depathologized your experience. So you were given a message, you always needed to get 8 hours of sleep. And if you didn't, you were falling short. And I have a similar makeup, Ande. I don't need as much sleep. And I don't sleep as much as my husband, for example. Right. He needs his 8 hours. I could get by with 6 hours and be just fine. And so the provider matched the treatment to you, not you to the treatment. And so if you're looking for your listeners, a mental health provider, some providers may not be so good, right? And you have the right to write a letter, like Ande was saying. You have the right to say, this isn't working for me. And also, I'm going to look elsewhere. Do you have other recommendations? And the provider, if they're good, wants you to have a good match, wants you to get better. And if they'll know that they're not a good fit for you too. And so my hope is, though, that you don't give, if you have a mismatch with a provider, that you don't give up, that you find, like Ande did, a provider who's willing to match a treatment to you, rather you to their treatment.
Right.
And who explains the condition that you're living with in a way that you can digest it and understand it and hope and believe that you can get better through treatment. I think
Right.
that's part of the psychotherapeutic and healing process too, is a belief and knowing that your provider believes that you can get better as well. And maybe, like, you're living with chronic pain, for example, maybe that provider can't eliminate the pain, but maybe that provider could work with you on eliminating the suffering that results from the pain. And so finding your way through this is going to take time and good measure and patience.
And especially if you're in pain, you're exhausted from the pain. So
That's right.
Find an advocate in your life who isn't in pain, who can help you, right? And find, I mean, seriously, fire those folks who are not in alignment with who you are, and be that smarty pants that's built up crisis competence over the years, and find a way to get the mental health that you deserve. I wish there were a mental health facility on every corner, like a pizza joint. Hey, I'm going to get a slice after I see the doc, right? Or have my therapy session. I just think it just needs to be that normalized. Or just, you see a Planet Fitness. They need something at that level for mental health, in my humble opinion. Can we take a second just to chat also about, you had a wonderful reel that you put out recently, and it was about talking about finding the meaning in our lives instead of regrets, answering the question, was my life meaningful? Now, as someone who longevity is in my gene pool, my dad passed at 101, my mom at 96, my grandmother at 99. But still, I have, deep fears around death. And I loved the story you told earlier about the hospice person saying, "Oh yeah, I'm good. I'm comfortable with this," while you were going, "No, I'm not done with my life." And I'm just afraid of it, period. Just probably lack of control, maybe, or just letting go. Can we talk about how mental health can help us reframe our life and get us comfortable with whatever our date is? It could be tomorrow, we don't have an expiration date on our booties, everybody. Ande Lyons expires on this date. So we need to, but I know this is not talked about enough, Dr. Regina, right? About, okay, you're going to take your last breath, and whether you believe you go join God, heaven, your pets, your family, or whatever your belief system is, it's still, you're going to be leaving everything that you're seeing around you behind, your loved ones, your favorite pets, whatever.
Life as you know it.
Life as you know it. When you don't need to live with that anxiety, how do we navigate this? And also, like your reel said, how do you answer the question, was my life meaningful?
Yeah. Erik Erikson is one of the godfathers of developmental psychology, and lists out sort of what we need to do at each stage of our life to live, to reach completion in that stage of life. And at the final stage of life, there's the question, was my life meaningful? And the idea with this is that there's a process that happens organically, naturally, of life review, where we review our life and bring together the strands of our lives into a complete whole. And we look at the shadow side of our life and the bright side of our life, and we merge them. And we maybe describe it in narrative, maybe write a memoir, maybe describe it in psychotherapy, tell our grandchildren's stories, tell our friends' stories, whatever it is. There's an organic process that happens where we begin to weave the strands of our lives together and answer that question. Was my life meaningful? And we do this even, there's a book called After on near-death experiences. Have you read it, Ande?
No, but I'm going to.
So he's a psychiatrist who looks at near-death experiences and does research on near-death experiences. So these are people who have died, they've flatlined, or unconscious, and their brain's not working, and have a sort of near-death experience, like people, they're different from hallucinations, but this sort of experience where they see the light or they have a guide, or one very common experience is an instant life review where you pull up your life. And even in this moment, and these happen in a flash because space and time is gone. And so it probably feels almost like a dream, like dreams happen in a flash and it's been a second and so much has happened in that dream. But people describe an experience of life review where the strands of their lives are coming together and in a cohesive whole and making a narrative out of their life. And they get a message often in that near-death experience life review. It's a beautiful book. I highly recommend it. It's really
it's going to be behind me too. I love this idea.
Yes, it's remarkable and beautiful and inspiring and love-filled. And that has been my experience. There's a psychotherapy that's called life review therapy. And it's one of my favorite psychotherapies to do with people because I love stories and listening to stories and helping people bring the strands of their life together. But you don't have to be a therapist to be therapeutic. You could ask people in your life, tell me about these times in your life. And that will facilitate the life review process for somebody and also may bring you closer together, which is so beautiful too. But so I think that's one experience that people have. And this also happens as people, you don't have to be end of life or dying to have this experience. You could be well and good.
And you can have it at any age, because the minute you actually experience death, I mean, real death, where that person was breathing and talking to you, and the next minute it's a body, I think that's a moment where you do get triggered into going, whoa, that could happen to me. Like, really?
Oh, yes. Oh, yes. It calls into the room questions of mortality, spirituality, what happens next, where did they go, what is my role? And if we're not careful, death anxiety too. And so people need a lot of support during this time. So not to get so overwhelmed by the mortal experience. I think that can be very naturally scary and terrifying for people. And so I think this also kind of bleeds into the grief conversation. But I would say the other piece of this is that we're so focused in the aging experience on physical aging. And that is a conversation that's all about preventing decline. And what we, I think, miss out on is this whole other world of conversations of psychological and spiritual growth, which happen even when we're in physical decline, that we can cultivate our spirituality, that we can cultivate our sense of community, that we could cultivate generosity and legacy. And there's so much to be gained psychologically, spiritually, even as we're losing physically. And that's the conversation we're not having enough.
Oh, are you kidding? I think the best thing I ever did for myself was when I posted first time I came out about my age, because especially women of my generation, you're never supposed to talk about your age. And I came out with the US 66 sign in front of me, took a photo. And when I turned 66 and came out, it was so liberating. But the next step is to fight the anti-ageism, which is anti-aging movement, which is, don't you be getting old. Now just stop that. You don't want to be looking that way. And when you can look in the mirror, I had to go try on bathing suits recently. And I was like, what fresh hell is this going on with my body? Right. And then I said, well, you know what? You had a good body for years that looked good in a suit. Nowadays, not so much. That's okay. It's this level of acceptance, right? That we need to just look at ourselves and go, what are these barnacles? What are these brown spots? Whatever is going on, right? For aging, how can we accept that with love and appreciation? And I think it's what you're talking about, this level of acceptance.
Yeah, and self-compassion, I would say. And self-compassion has three components. There's, and I hope I'm getting them right. One is the sense of common humanity, that you're not going through this experience alone. Like every woman now, probably at a certain stage of life, is trying on a bathing suit and thinking, Now, it did not look like this 10 years ago.
The vein, and I'm not talking about, fat hanging over and any of that. I'm just talking about the body. It's aging. It's older now.
Oh, yes. Yeah. And there are wrinkles that were there that were never there before. There's skin that's not as shiny, like whatever it is that
the veins, the everything. Yeah.
And so one is common humanity. This is happening to everyone, not just me. I'm not alone in this.
Right.
Another is mindfulness, that thinking I'm in my body and my body works for me. And finding something that you're honestly grateful for in your body. Like, I'm 49 and have my own
please
things to figure out in my body with perimenopause and menopause and
what a mess. I'm so glad that's behind me, just saying, everyone.
Yeah.
It's tough.
And so I have to tell myself I am in my body and am strong because I'm doing weightlifting. And so I'm telling myself something that's honest and being mindful about that. And then the third thing with self-compassion is to talk to yourself as you would a dear friend. And so now I'm saying to myself, you are beautiful. Your body is strong. Your curves are your resistance. Like trying to make a political movement out of my.
But it's so important. I saw a meme on Instagram recently that was so wonderful. Yeah, I'm working on my beach body. I have great balance, strong muscles, right?
Yes.
That's my beach body as an older adult. I love that. I recently shared a short. I love to curate shorts on my YouTube channel. And I shared this one where this wonderful assisted living home, I think in Illinois somewhere, shared a group of maybe 10 of their clients taking a picture of them in their 20s. So it's holding it up in front of their head and then slowly bringing it down and just showing their beautiful faces. They are in their 70s, 80s, and 90s. So you can see the meaning of life from that moment to there, that they are still precious. They're still so important. It actually got, I think, 4 million views, but because it touched so many people, right? To see that, oh yeah, I'm still a valuable person. I mean, this is what I was looking like when I was kicking ass, but right now I'm still a sweetheart, right?
Oh, and maybe even more. Like you're bringing with you that person and
That's
all
right.
the other people you've gained along the way.
Right.
Like you're the one kicking ass now.
Right.
I mean, we're all striving. Like we started this conversation with end of life, and you and I we're not ready to die.
No.
And so if we're lucky, we're going to live a long time. We're all striving to get there. And so how is it that we're all striving to get there and we diminish it or devalue it? And I will also say this is a cultural thing. It's more diminished and devalued in white spaces.
That's right.
And Black spaces or AAPI or Asian American spaces.
Exactly. In other countries that revere the elder, the shaman, the wise one, and count on their wisdom. Oh my gosh, this is such a good conversation. I just want to pop up Michael Booth's comment. And folks, who you were listening, we were talking to Michael Booth. He was diagnosed at the age of 46. But he's saying here, that's why we should not say dementia is a group of symptoms, but rather a group of conditions. Because doctors then say that a symptom related to dementia is dementia just because you are over 65. Age is not dementia. There should be an investigation into cause rather than a diagnosis because you're getting old. Oh my gosh, Michael, thank you for that clarification so much.
Wow. And Michael, you're so right that often providers do conflate dementia with age and do conflate, even people have cognitive impairment for all sorts of reasons unrelated to dementia, like medications or not sleep, insomnia, or all sorts of things.
Yes.
And so you're right that a workup is required to accurately identify whatever the condition is that's causing cognitive impairment.
Oh my gosh. I have to get another question in because I do want to wrap this up in a timely fashion, but I'm going to have you back, Dr. Regina, for part 2, because this is so fascinating. And as Amy said, such a good conversation.
Oh, thanks.
It needs to be broadcast wide. I agree, Amy. This has been so informative and uplifting as well. Um, so, how can families and caregivers better support the mental health of the older adults in their lives, especially when there's some cognitive decline or resistance to help is present?
Yeah, you asked the resistance question earlier, and I think this is an important one. Actually, the first video I ever made and article I ever wrote was my aging parent is refusing to go to the doctor. What do I do? And here's the thing: is sometimes you do nothing, but sometimes the resistance is not resistance. Sometimes it's not about what they're fighting against, is what they're fighting for. I'm fighting for my independence. I'm fighting for these decisions to be mine. I'm fighting for being seen and heard. And so what I would say is, if you're noticing changes, and you might be noticing changes and you have concerns that are legitimate, I think the approach is key. How you approach the person in the conversation with, I'm noticing some changes. Have you noticed? Or even prior to that, even before going in, saying, how are you? What is life like for you right now? How are you spending your time? Is it fulfilling? Are you getting enough of whatever in your life? Do you need more of something else in your life? You're just starting a conversation that's not about pathology or concerns, but about the person's humanity, I think is key. And if then that leads to the concern part, I think being caring and careful and honest and being mindful of how you're coming across. Sometimes when we're scared and concerned, we might come in blazing, like, you are not doing what your doctor told you to do, and if you don't do what your doctor told you to do, here's what's going to happen, and I don't want to be the one, blah, 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 right? And so what I would say is, I have noticed some changes. This is what I've noticed. I know that there is very good treatment. Can I help you investigate that? Have you noticed these changes? And the person says, leave me alone, I don't want to talk about it. Respect it. People have boundaries and are entitled to their boundaries. And then I would say, give them some space and grace to come around. This might be the first of many, many conversations that I hope that you will have. But here's what I hope does not happen. I hope if the person says, just leave me alone, I don't want to talk about this right now, I hope that you don't go away. I hope that you stay connected, even if they're not ready or willing to have that conversation now. I think the isolation and loneliness is harmful too. And so maybe you're not at the place where you could talk about mental health care or whatever the next level of care is for that person, but stay connected. The stronger your relationship, the more influence you will have down the road. And so fostering and cultivating the relationship is key to sharing your concerns down the road and having an honest conversation about this later.
Right. And I firmly believe too that you're planting a seed. So when you first come to that person with the thought of perhaps getting some support and mental health, and they brush you off, you have planted a seed. And because they're thinking, oh, mental health, they're going to start seeing other things that they may not have seen before, because you've brought that to the forefront of their brain and mind, and they're going to get information. And you know this, if you've been a parent, you could say something, or to a good friend, you could have said, the best advice they ever got, but because they got it from, your children got it from a friend or someone else, and you're like, duh, I told you that years ago, but it sinks in.
Yes, and it also takes time for whatever is happening. It doesn't often match who we know ourselves to be.
Yeah.
So if somebody's saying you've changed and the person living it is like, well, what do you know? You're not in my body. Like, you don't know all I've been through. I think that's the self-concept doesn't match always what the symptoms are. And so it takes time for those two to meet, the symptoms and the sense of self. I personally, I had postpartum depression after my first child, and I had, and I had a mom with severe mental illness, and I was like,
Right.
I'm a psychologist. I get through. And I remember a friend of mine who was a psychologist, we were on a walk, and she was older, maybe 10 years older than me. Um, I was telling her about my experience. I felt really numb. I was hyper productive, but I felt very numb and disconnected emotionally. And she was like, "You sound like you have postpartum depression." And inside of myself, I didn't say this to her, I revolted.
Oh, sure.
I
The
was like,
shame.
"No, that is not me. I don't have inside I was protesting. I
Right.
didn't say anything to her, and it took time for me to come around to understanding, "Oh my gosh,
Right.
this is it." Like, yes, I do. And I can relate often to older people who are like, "What do you know? You're not in this body," and sort of protesting, "I can get through this. This is just, a hard stage and I'm going to muscle through." And so it takes time. So be patient. Don't give up on the person. Don't give up on the relationship. Respect their process and still be engaged, compassionate, and concerned. I think it
Yes.
is okay to be honest and transparent without beating them over the head.
Right. And if they do come back to you and they seem a bit abrupt and maybe a bit angry and a bit aggressive or assertive, it could be that they have been taking care of everybody else's needs their whole life. And all of a sudden they're feeling empowered for their own happiness. Get out of the way, kid.
Yeah, move aside.
Uh,
Well, I mean, there are so many variables
I
I can
know.
imagine, or they're uncomfortable, or if they have to go to the
Uh,
bathroom and you're in their way, you're like,
uh,
so many
yes.
variables.
Sometimes, they've just had it because they've been so nice their whole life, especially women. Oh my gosh. And yes, Amy, amen to all of this, Dr. Regina. We are going to be sharing this conversation far and wide. Dr. Regina, I love that. Not only do you have training, do you have patients? Do you have clients too?
I have a very tiny caseload,
Mhm.
but what we have at the Center for Mental Health and Aging is a list of providers nationally who specialize
Great.
with older adults. We have a provider directory that's free to use, and every person in the directory has a license to provide whatever their mental health discipline is in their state. And so you can go to find a licensed mental health provider who specializes with older adults at mentalhealthandaging.com.
Excellent. And folks, I got to tell you, I'm the first to go searching for the person who takes Medicare. And that's how I found the Dr. Zhao, who helped me with my insomnia, et cetera. There are people out there that can help you. He was cash, by the way, but it was a good therapist that led me to him. And so it's so important. Dr. Regina, how can people follow you and work with you? We're going to go to your website, mentalhealthandaging.com. I know you're on Instagram under Dr. Regina Koepp. What
Yep.
else?
I'm most active probably on LinkedIn. And so I have a clearinghouse of resources at mentalhealthandaging.com. I put out a weekly mental health tip. Um, and you can join my email where you get the weekly mental health tip. And you can also do that at mentalhealthandaging.com. Just a heads up, I do sell things there to mental health providers, like courses that we put out.
Great.
If I have enough interest, maybe I'll make a course for the general public. But I really
Oh,
love giving information for free to the
well,
general public.
and this is how word of mouth works. People are going to say, "Oh, I heard you or saw you," and don't be caged by your age. And talking to their provider, letting them know that they can get additional training in this area. And I'm hoping more people get trained in this area so I don't have to have conversations. And for the record, my doctor that I sent that letter to is at least 60. So, and a woman. So I'm thinking, gendered ageism is not gendered based. You can get it from male, female, etc. So this has been such a wonderful conversation. Dr. Regina, your advice will impact so many listeners and viewers for years to come. Thank you so much for joining me.
Thank you so much for having me.
So much fun. And thank you to all the folks joining us live today and to those listening later. I am truly grateful for your time and presence. Please keep those questions coming. We need to always be talking about mental health for older adults. Until next time, please remember you have so much to give. Don't let those internalized ageist beliefs prevent you from pursuing new dreams, and opportunities. Grab that torch and keep it brilliantly lit for you and for future generations. Wishing you a delicious day everywhere you glow. Bye from Boston. Mwah, everyone.